Is it easier to get health insurance if I have a job?
Hi, I'm Emily Beaver, and I've been blogging about healthcare reform for Youth Radio. Usually it is. It's easier to get healthcare if you have a job usually than if you don't have a job, but not all employers provide healthcare for their employees. I just talked to a young man who works as a direct care worker, and that means he takes care of a person who has a disability, and he doesn't get insurance through his job even though he works full-time. So not all employers will say just because you're working will provide you health care. That's a benefit. But if you're not working, you can't get what's called a group health insurance plan, which are the kind of insurance that employers offer. So it can be harder to find health care if you're just looking for it by yourself.
And what kind of jobs can you get healthcare with? Like a main job that really always gives out healthcare?
That's a good question. A lot of larger companies, and if you think of companies like Ford or General Motors or the auto insurance companies, will offer health insurance. Some small companies, like small restaurants or coffee shops sometimes will offer health insurance, but they're less likely to. If you're self-employed, if you work for yourself, say you own your own business, or you're a musician or a freelance photographer or writer, you're your own employer, so you have to find your own health insurance. So if you work in a job, if you're self-employed, it's harder to find health insurance. You have to go out and look and try to buy it for yourself.